Switch gears and head back to Mr. Makaire. Yes, he's still with me, Mr. Frederick Makaire. We are talking about insurance health schemes, community insurance health schemes, and how best they can help in this fight against COVID-19. A very good morning once again, Mr. Makaire. I'm sure you're now okay as far as internet and technology is concerned.
Yeah, I'm now very okay, Romeo. I'm sorry for that. Once again, good morning to your viewers.
It's okay. The fourth estate, the fourth industrial revolution is like that. We are used to it. So, Mr. Makaire, I'm sure you're doing some very good work at Self for Health. I want you to expound on that. What exactly are you doing? And the issue of the community health schemes.
Well, what we do mainly is to promote the community health insurance programs, which basically allow community members, especially those with low incomes and poor people, to mobilize some little resources in advance. Then once they have put that into a pool, they are able to access healthcare services without requiring to have cash each time they fall sick. In crises, this one, where we are under lockdown and people are not working, the community members under the community health insurance schemes would have their insurance cards, and if they need to go to hospital, then they just go. They don't have to have cash. They just move to the hospital and get services. So that's what we have been doing since 1996. We have reached about 32 districts, and now the total number of people covered in the community health insurance schemes are about 170,000.
Mr. Makaire, countries that are developed like the United States use 18% of their GDP and it goes to the health sector. But Uganda here, our per capita spending on health is at 6%. How will the community insurance health schemes help bridge the gap?
Well, insurance could help bridge the gap because it mobilizes more resources. I think what the government here and other African countries are doing is, especially those that provide free health care and cover everything under tax, they need to work with insurance where more resources can be collected. Every individual gives some little contribution to the premium, and then when you add that with the tax allocation that government contributes, then we can easily raise the contribution to a minimum that the African Union recommends, the 5%, even the 15%. So I think health insurance would help a lot because it mobilizes additional resources from community members, and then it goes to a pool. So that would be a very good position at this moment, especially.
Amazing, Mr. Makaire. And there's also another contentious issue. Uganda has only 55 intensive care beds for 42 million Ugandans. Do the insurance schemes that you design put such discrepancies into, regard?
Come again, sorry?
I'm saying, Mr. Makaire,
Yes.
Can you hear me?
Yes, I'm hearing you now.
Yes, I'm saying Uganda has only 55 ICU beds for 42 million Ugandans. So do the insurance schemes that you design put such discrepancies into the consideration?
Yeah, they do in the planning, but you see the community health insurance schemes especially, and other insurance schemes, especially the private ones, we do not own facilities, so we rely on what is available in the market, the government health facilities and those in the private, especially PNFPs and some PFPs. So when we have very few ICU beds and other facilities like that, basically the schemes would for this. We do not have special hospitals where we treat our patients. They go to the same facilities. So basically, if there are not enough needs, our insurance members are going to be affected the same. Although the difference would be that if it is a normal illness and not COVID-19, they have an advantage because they have access. They don't need the money to be able to access these beds. compared to those who may actually lose money and may not access these beds. That's the only difference. Otherwise, the number of beds we have is not enough for all of us as a country, and that is something we need to work on as a country. For insured people, uninsured people, all of us together need this.
Thank you very much, Mr. Makaire, for your very great insights. Thank you very much for joining us. Yes,
thank you.
I've been talking to Mr. Fred Makaire. He's been very resourceful in that regard. But we are also now going into another conversation. Now, there have been complaints about how the LD